This week on Mount Sinai Spotlight, the Affordable Care Act stands as the law. CEO Kenneth Davis of Mount Sinai Health System says we should focus on bending the cost curve in medicine.
In this debate, we have lost sight of what the real issues are. The real issues are we have to bend the cost curve in healthcare. We have to make healthcare less expensive. We can't afford it. That means moving away from fee-for-service medicine and being reimbursed more for value. That means being rewarded for keeping people well, keeping people out of the hospital, keeping people out of the emergency room. That's a different kind of reward system than we currently have in fee-for-service medicine. We have been slowly moving toward that over the last few years. We need this debate in Congress to ask, how can we accelerate that? And we also need to address, what are the big drivers of healthcare? What are the diseases that are driving costs? Well, it's type 2 diabetes with obesity, and it's Alzheimer's disease. Those two conditions are going to bankrupt the Medicare system. That means we have to develop treatments for those diseases. We're not going to develop treatment for those diseases if we cripple the NIH budget, which is part of the budget that has been proposed. After all the debate of the 21st Century Cures Act, the conclusion was we will increase the NIH budget. After all the discussion about the cancer moonshot, we realized we have to spend more money in cancer. If we don't spend more money for those diseases that are really driving healthcare costs, we will bankrupt the system.